Patients ask me every day, what's the best brushing technique, what toothpaste they should use, what kind of toothbrush they should use. And I tell them those things matter very little. What matters is daily consistency, using the same product every day and being consistent in your habits. The brands don't matter that much, the tools don't matter that much, and the technique matters a little, but not as much as you think. The most important thing is consistency with your habits. Is there a major difference between the teeth whitening options that you can get at the dentist versus teeth whitening products that you can buy online or at the drugstore? Yes, there is. There's a big difference. Here at my practice, Dougherty Cosmetic Dentistry, we're big fans of the Core whitening system. And one of the things I tell patients with Core is that we're going to take a before picture and an after picture, and you're going to see some incredible results. I've never seen a great before and after photo with a take-home whitening system that you can purchase at the grocery store or the drugstore. With our experience using the right tools, the right techniques, and the right at-home protocols, we can get great results for patients that they can really notice. I think the most important thing about creating a great oral hygiene routine is having your tools ready to go all of the time. Sometimes I'll talk to patients that need to improve their flossing, and I ask them, where's the floss in your bathroom? Like, if we go in your bathroom right now, where's the floss? And they tell me it's in a drawer, it's in the medicine cabinet, it's somewhere tucked away. You're never gonna have a consistent flossing habit unless you have your floss out. So leave it out on the sink right next to your toothbrush to make sure to remind yourself to use it every day. Managing dental anxiety in the practice, I think it starts in the reception room. When patients come into our practice at Dougherty Cosmetic Dentistry, they see a warm, welcoming environment, and I think that can help ease some anxiety. And the next place it gets eased is once we get into the consultation room. Before we ever seat patients in a dental chair, we sit down in a regular room, face to face with each other, and discuss why the patient's here, what their needs are, and if they have anxiety, we can talk about it. What's helped them in the past? Did they need to be sedated? Was nitrous an option? We try to get to the bottom of what their fears are so that we don't make mistakes that other practices have made with the patient. Once we decide an appropriate plan to manage a patient's anxiety, we take it one step at a time. Whether it be nitrous oxide or IV sedation, we do what it takes to make sure that the patient can get the treatment they need in a comfortable environment and to manage anxiety in a way that helps them get done what they need to get done. How frequently should you visit the dentist to have your teeth cleaned? At my practice, Dougherty Cosmetic Dentistry, we tailor this answer based on a patient's needs. There's some patients I see that need their teeth cleaned every 3 to 4 months. A lot of patients we have on a 6-month recall schedule, and there's other patients that once a year is sufficient for them. I think it's important to tailor the decision for how frequently a patient should be seen based on their individual needs, their history, and what's best for their overall health. When I interview a new patient, there's a handful of questions I ask everyone. And one of them is, do you grind your teeth at night? Another question I like to ask patients is, when is the last time you had a medical checkup? Has a medical doctor ever recommended you have a sleep study performed? When patients tell me that they grind their teeth at night or that a sleeping partner has told them that they grind their teeth, they think they might have a dental problem, but most of these patients are suffering from an airway problem, a sleep-disordered breathing problem. They need to consult with a physician and potentially have a sleep study performed. From there, we can help them get to the bottom of their systemic health issues and hopefully help them stop damaging their teeth. Most of the patients that I treat with Invisalign or full mouth rehabilitation are in their 50s, 60s, and 70s. And we do this treatment not just because they want to look better, but we do it to set them up for functional health and success for the rest of their life. When your teeth are straight and when your bite is right, it's easier to keep your teeth clean, it's easier to keep them cavity-free, and it's easier to keep your gums healthy as well. So these treatments are important even for older adults, as a matter of fact, especially for older adults that want to keep their natural teeth the rest of their lives. Staying at the forefront of technology is important in any industry, especially in healthcare and especially in dentistry. There's a lot of dental technology on the market, and I try to evaluate as much of it as I can to decide if it's going to give my patients a better experience in the chair. No one wants to go to a dental office that looks out of date, like they don't use technology, and we want to make sure our patients have the best experience possible. If you need to replace a missing tooth, dentistry has three main choices: a removable partial denture, a fixed bridge, or a dental implant. At Dougherty Cosmetic Dentistry, we can help patients that are missing teeth determine which is the best treatment option for them. Every single clinical situation is different, every patient's needs are different, and it's important to sit down with a dentist that you trust to go over the options to decide what's best for you. Nutrition is more important to your oral health than you might think. Every day, patients ask me, what's the best toothbrush? What's the best toothpaste? But the most important things a patient can do to improve their oral health is to stop smoking or never start smoking and eat healthy foods. These two decisions alone will impact your oral health much more than what toothpaste you choose or which toothbrush you choose. If you're considering getting dental veneers, it's important to sit down with your dentist to discuss what your treatment goals are and selecting the proper material. At Dougherty Cosmetic Dentistry, we can sit down with any patient to go over what the best treatment options are for them. We offer composite veneers and porcelain veneers to our patients. Composite is a great material choice for teenagers and younger adults in their 20s. Porcelain veneers are great for patients in their 20s and older. It's an excellent material choice that is more lifelike, stronger, and looks great. If you're looking to get veneers, we have the experience and the systems in place to help you make the best decision for you so that you can get the smile that you've always wanted. When I think of dental hygiene tips for seniors, the first thing I think of is Invisalign. As we age, our manual dexterity decreases and our saliva production decreases. So what does that mean? It's harder to keep our teeth clean, and our body's natural defense system for fighting bacteria, fighting cavities, fighting gum disease decreases. At my practice, I like to set my patients up for success, and that's why I consider clear aligner therapy like Invisalign even for senior patients, so that their teeth are straight and easy to keep clean. Let's talk about tooth stains. The first type of staining I think of is stain that's on the outer surface of the tooth. This can be removed with a toothbrush and the right toothpaste. Sometimes if your teeth aren't aligned properly, it's difficult to get to areas and they become stained, but this can be removed easily with the right tools. The second type of staining is deep inside the tooth. Maybe you've been drinking coffee or red wine for a long time and there's color deep inside of the tooth. This has to be removed with bleach, whitening gels, something professional from your dentist. The third type of staining is staining deep inside of the tooth. Maybe your tooth has had a root canal before, and material from the root canal or the nerve of the tooth has leached through the tooth and changed the color. This needs to be bleached from the inside by your dentist. Here at Dougherty Cosmetic Dentistry, I'd be happy to sit down with you and discuss the stains you have on your teeth and what's the appropriate treatment for you.